Welcome back, viewers, to Faith and Discipline podcast. Our topic today is COPD, that's Chronic Obstructive Pulmonary Disease. And our guest is Dr. Ali Waqar. He is a respiratory consultant. Welcome, Dr. Ali Waqar, to Faith and Discipline podcast.
Thank you very much.
Right, let's begin. What is COPD and what are the symptoms?
So COPD stands for Chronic Obstructive Pulmonary Disease. And essentially, it's a disease which is related directly to smoking most of the times. A subset of these patients will acquire this disease, and it's hereditary in those circumstances, but that's only a minority of the patients. But even in those patients where it is a hereditary disease, smoking plays a major role in causing symptoms. So COPD has two components. The first component of this disease is called chronic bronchitis, and that is defined as someone who has a chronic cough, which is a long-standing cough, for more than 3 months and is a smoker. So that's usually one of the starting symptoms of COPD. The other component is, so this was where it affects your airways. The other component is when it starts affecting your lungs and causes damage to your lungs. And that component of the disease is called emphysema. So that causes alveolar or tissue destruction of your lungs and is directly related to smoking as well.
So my next question is, what is the difference between asthma and COPD? Because asthma seems like COPD as well, isn't it?
Of course. And the symptoms are actually quite similar. However, the diseases are very different. So the predominant symptom in both asthma and COPD is cough. The differentiating factor comes in with whether you're a smoker or not. COPD is directly related to the effect of smoking, whereas asthma is not. Asthma is something that you're allergic to, something that is in your environment, and that causes the symptoms. Coming towards the symptoms, both can cause cough, shortness of breath, and wheeze. So if you are experiencing these symptoms and you're a smoker, then you could have COPD, you could have asthma, but you need differentiating tests and you need to go see a respiratory physician who can differentiate between the two.
So what is the real cause? Because the asthma can cause due to, there's a fungus in the environment, like the person where he's living is Aspergillus fungus there, or due to pollens and things like that. But what really causes COPD?
That's a very good question. So asthma, what happens is you can think of asthma is in broad layman terms as a hyperallergic reaction to something in your environment. And that, as you rightly said, could be a fungus or it could be something in the air. It could be something as simple as dust. Whereas COPD is related directly to the effects of smoking. It is the damage caused by chemicals in the smoke and the damage that the patient is inhaling, and those things are causing the symptoms. Because both things are going into your airways and into your lungs, the symptoms can be quite similar, especially in the starting stages.
Okay. Some of the diseases like lifestyle factors or environment plays a role. Does COPD is one of them where lifestyle or environment can make it worse or calm it down?
100%. So coming towards the lifestyle, COPD is directly related to smoking. That is the most common cause of COPD throughout the majority of patients that we encounter. A minority or subset of patients will be those who are either being exposed to passive smoking. So this can be either due to being in the same room as a couple of smokers. So if the room is full of smoke, then you will eventually develop COPD if you have chronic exposure to that smoke. Or if you're in an area which is heavily polluted. So if the majority of your time is spent in an industrial area which is just full of toxic fumes, then you're more at risk of COPD as well.
So how do we diagnose COPD? Because asthma, we do spirometry and that type of there's a long list of tests we do. Is it similar to diagnose COPD?
So it is. There's a couple of tests that we do once a patient comes to us. So as you said, pulmonary function test, which is a breathing test that we do. So we ask the patient to breathe and we look at a couple of parameters in their breathing. The major hallmark and one of the major differentiating factors between asthma and COPD is reversibility. So if we give a certain medication and we see that the patient's breathing is improving, it is more often secondary to asthma, whereas COPD, giving medications doesn't really improve those parameters. So breathing test is definitely one of them. The other thing that can sometimes help is having a CT scan done. There are subtle clues in CT scans that we look out for, which is essentially lung destruction, which we don't really see in asthma.
So, some of the diseases, they are like certain triggers. So COPD is one of them. There's a trigger that can make symptom worse. If it happens, what the person need to do?
100%. So the thing to understand here is, as the name implies, COPD is chronic obstructive pulmonary disease. So it is something that is running on in the background, and there's low-grade inflammation causing destruction of your lung, essentially. But this is exacerbated, and the exacerbation symptoms can be a viral infection. So if a lot of the patients, when they get a viral infection, it triggers their COPD and causes their symptoms to get worse.
If we look at statistically, which age group is mainly affected? Younger ones or older ones?
So it's middle age. So you have to have a certain amount of smoking history in the background. Okay. So COPD isn't something that will develop just because you've had 1 cigarette or 5 cigarettes or 10 cigarettes. It happens over years. So the majority of the people who start becoming symptomatic with COPD, and when it is often diagnosed, is middle-aged. So people who've smoked more than 20 cigarettes a day for 20 years or 30 years are the ones who will eventually go on to develop COPD.
Okay. So what are the main symptoms? Like some people, the smokers, they produce phlegm, the voice is changed, a bit hoarse voice, and then they like cough a lot. So by looking at it, can we tell the person has COPD or?
Of course, there's markers. So if someone has a cough which is not going away, and if they're a smoker, it's been more than 3 months, they very much likely do have chronic bronchitis. So then, because as I mentioned, there are two elements. There's chronic bronchitis and there's emphysema. So that is the chronic bronchitis element. The other symptoms that patients often experience is shortness of breath. Because when you don't have viable lung tissue left and your lung isn't functioning anymore, then you start developing shortness of breath. So, for example, if a patient was able to walk 2 kilometers without having to stop, their exercise tolerance will start decreasing. So they will now only be able to walk, let's say, 1 kilometer, and it only keeps on worsening. The one thing to remember about COPD is that it's a progressive condition. So once a patient acquires it, it continues to get worse. So that kilometer exercise tolerance will eventually become 500 meters. That 500 meters over time, if you leave it, will become 100 meters or so.
I can understand it can be quite distressing for someone who has been quite active in their life.
100%.
So my next question is related to that. Is if someone is been all their life, they've been playing sports or doing vigorous exercise, can they carry on while having COPD, or they have to stop it?
So you have to remember, COPD is a spectrum. So the way we classify COPD is according to how good or bad your lung function is. Is whether you've got mild, moderate, or severe. What we often find is patients with mild COPD don't have a lot of symptoms. Whereas patients who have severe COPD, even doing normal tasks such as getting up to go to the bathroom, going up the stairs is a big struggle. So it depends on what stage of COPD they are. If they have mild COPD, they might just have mild restriction of their exercise, or they might notice, as I mentioned, if someone was an avid cyclist all their life, they might not be able to cycle as far as they were before. Whereas someone who has severe COPD, they'll have entirely different symptoms.
Okay. So if it is, how serious it can be if it is not managed properly? So
it can be life-threatening. It can be. So eventually, it gets to the stage where there just isn't enough viable lung tissue left. So that is the stage where all the body's respiratory homeostasis is affected. And so by that I mean the amount of oxygen that you can take in, because you're taking in oxygen, you're breathing out carbon dioxide. So if you don't have lung tissue and if you don't have that mechanism, then oxygen levels go down because it's not being absorbed. Carbon dioxide levels start rising up in your body, and then it can be critical at that stage.
As we talked about symptoms, but like similar diseases like TB or pneumonia, or even patient with the heart problems, they suffer from dyspnea, so like shortness of breath. How do we differentiate what exactly that is there any particular symptom for pneumonia, for TB, and for COPD? So
they're all three very different diseases. Excuse me. So pneumonia is usually most of the times an acute illness. So it will cause a high-grade fever, and usually patients cough up yellow-colored phlegm, and they're very unwell. They will often have a viral infection on board before pneumonia develops. So pneumonia, in simple terms, is a bacterial infection into your lungs, and it's usually an acute event, and patients are quite unwell most of the times with it. So COPD, on the other hand, is smoking-related damage to the lungs. So patients will have symptoms for a number of years, whereas pneumonia patients will only have symptoms that have appeared just over a week or maybe even a couple of days.
Okay. According to clinical studies, more than 40% of older COPD sufferers, they suffer from depression as well, same time as COPD. Is there any link between COPD, anxiety, and depression?
100%. So a lot of the COPD patients are depressed. Part of the reason is that they're no longer able to do the jobs they were able to do before. So obviously the quality of life is impacted. So there's a direct correlation between depression and COPD. We are now also finding that we used to think that this was a direct damage of smoking to the lungs, but what we're now realizing with latest research is that COPD is a chronic inflammatory state. So there's low-level inflammation in your body going on. And there is also good evidence to support that a lot of COPD patients have a high incidence of heart disease as well.
Okay. Some of the COPD medications, can they make things worse if the patient is depressed? Is there any role of medication making things worse?
I don't. There's not the inhalers as per se, not to my knowledge. Okay. The treatment of COPD mainly centers around the main thing should revolve around smoking cessation. If you continue to smoke, the lungs will continue to get damaged, regardless of whatever medications you use. Okay. The medications that we end up using in COPD are mainly inhalers, and they improve quality of life, so they will lessen the dyspnea and the shortness of breath and the feeling of shortness of breath, but they don't prevent progression of the lungs, and they don't prevent progression of the disease, unfortunately. Okay. That is why it's extremely important to prevent further accelerated lung damage by smoking cessation.
Okay. So what are the treatment options available?
Of course. So the treatment options it depends on the severity of the COPD. So we start off with obviously smoking cessation, that is the first, and then it revolves around inhalers. Usually patients start off with one inhalers and they end up on 3 different inhalers, but now we've got combination inhalers as well. There are other treatment modalities depending on the severity. Sometimes lung volume reduction surgery can be employed for a select group of patients, whereas there's another ventilation, non-invasive ventilation it is called, for very severe COPD patients who have high levels of carbon dioxide. It's called NIV can be employed as well. But mainly for most of the patients, they will end up on inhalers if they have COPD.
When we talk about inhalers, asthma sufferers, they also take inhalers like salbutamol and that medication. So are the inhalers same or any difference?
Most of the times, but at what stage, what kind of inhalers is deployed to the patient is different. Okay. But broadly speaking, it is the same medication that work across both the boards.
Well, same. In asthma, mainly the patient is recommended to take regularly their brown inhaler. That's a steroid medication. Is the one for the COPD regularly?
So that's a very good question. The inhaler choice is slightly different. Now, guidelines keep on changing. Guidelines are very dynamic. So every few years, sometimes the guidelines state and the treatment actually overlaps with asthma. The most recent guidelines state that we shouldn't really be employing steroid inhalers for COPD at present, and steroid inhaler is usually deployed at the last arm of the treatment when the symptoms aren't being controlled at all. So at present, it's what we called a LABA or a LAMA inhaler that is employed mainly to control inhalers. Okay,
thank you very much, Dr. Ali Baka. To sum up, what are your recommendations how someone can prevent themselves from this disease?
So the number one and foremost thing is to stop smoking. If it's not to take anything, look, anything exogenous that you're putting into your system that your lungs just aren't, it is not intended. There is damage from the smoking, there's cancer causing chemicals apart from COPD. There are other problems associated with smoking. So not only does your rate of oral mouth cancer or oral cancer goes up or lung cancer goes up, you're also developing this subset of disease which is slowly chipping away and destroying the lung and drastically reducing quality of life and shortening the number of years, as well as increasing the risk of other diseases like heart disease and depression. So my number one suggestion is to never take up smoking. But if you have, then seriously consider stopping, because eventually it will cause damage to the lungs.
Thank you very much. Some people, they work in chemical factories or they work in petrol stations, which is benzene. And if they're inhaling benzene regularly, does it cause any problem?
So definitely. If they're not taking precautions, I mean, nowadays, most of the places they will have strict policies about protective gear and protective equipment now. It's not like the old days anymore. But if you continue to inhale these things 100%, it causes damage to the lungs. It can cause pulmonary fibrosis. If you're inhaling fumes, toxic fumes or smoke, it will eventually result in COPD.
Right. Some people, they are keen on alternative medication therapies. They don't want to go down the conventional route. Are there any therapies available which are clinically proven to be effective?
For COPD? Yes. I'm not aware of such alternative therapies, but what my advice to most of my patients who want to seek alternative therapies is to not forget the basics and not forget the main underlying factor what caused the disease. So for example, in this case, it is okay to see if alternative therapy will help, but if they continue smoking, nothing they do will ever change. So the number one step is to find the root cause and eliminate the root cause. And then you can, of course, if you want to go, because not everything is researched upon. So I would say you have to keep allopathic medicine is based on years and years of research and data, and not to ignore the robust amount of data that we have on patients and experience, and to just focus on the root cause, which in COPD is to stop smoking, and then focus on other therapies.
Thank you very much, Dr. Ali Waqar, for joining me today. Your advice has been, I hope my viewers find very, very useful.
No problem. Thank you very much for having me.
Thanks, viewers, for watching this episode. If you found this useful, you can share with your family and friends. If you haven't already, make sure to subscribe. In the coming episodes, we intend to do our podcast live, where we would like to take your questions. And if you have any health-related issues, we'll try to help you. Thank you very much.